Good evening to all. I am Dr. Asawari Sawant, Public Health Specialist at IHW Council, and I welcome you all to this exclusive Hypertension Awareness Series, an initiative by Integrated Health and Wellbeing Council, powered by Servier. According to the Indian National Family Health Survey 5 of 2019 and 2021, it is observed that 21% of women and 24% of men have hypertension. 39% of women and 49% of men in India aged 15 years and over are already pre-hypertensive. May is the National Health Awareness Month, recognized every year by the Government of India. May is also the May Measure Month, which is the global campaign by the International Society of Hypertension to raise awareness around this issue. Partnering up with Servier and joining the May Measure Month, Integrated Health and Wellbeing Council has organized this month-long initiative to raise awareness on the growing burden of hypertension and to make people aware on the different aspects around hypertension. This live session today, we will discuss on the topic of innovations for bridging gaps in hypertension treatment and prevention, for which we have a very eminent set of panelists here with us. It is an all-women's panel of Medical and Patient Affairs for Servier India. We welcome you to the show, ma'am.
Thank you, Ashavi.
We welcome Ms. Roonam Mehta, who is the CEO of HealthCube. Ma'am, welcome to the show.
Thank you, Dr. Ashavi.
We also welcome Dr. Sapna Khanzode, who is the Senior Specialist for Internal Medicine and Critical Care Consultant in Nagpur. Ma'am, welcome to the show.
Thank you, Dr. Ashavi.
We also welcome Ms. Neha Rastogi, who is the CEO of Augusta Software Private Limited. Ma'am, welcome to the show.
Thank you, Dr. Ashavi.
So today we would be discussing on the topic of innovations that are helping bridging gaps in hypertension care and treatment. So let us start with our practicing clinician over here, Dr. Sapna. Ma'am, can you please set the context as a clinician? What gaps and barriers do you often encounter while taking care of hypertension treatment and prevention in your patients? And how do you envision innovative solutions addressing some of these issues that you face?
Right. So I'd like to divide your question in two parts. The first one was gaps and barriers, as you mentioned. Now, we all have the guidelines. We know that, hypertension is defined after a particular level of blood pressure. The problem these days is, as you mentioned rightly, 15 years and above are pre-hypertensives as well. A lot of patients or a lot of people are pre-hypertensives. And so still we are in one of the dilemmas as to when should a patient come to a clinician saying that, okay, I need to check my blood pressure and maybe I might be having high blood pressure. That's one point which is very, very important, because hypertension is a very silent disease. At times it will not present to you with goes up and eventually lands a patient into some kind of complication. So I feel that is one of the major gaps, that when should a patient consult? We still do not have a clear-cut guideline as to when should a person come to a clinician. Now, good part is that we have this health checkups which are made compulsory by many of the companies, and many people are aware, so they go into self-health checkups as well, wherein they can get diagnosed with the high blood pressure and then be asked to monitor their blood pressure as well. Now, this is one part when it's which is about diagnosis. The other part which is important is, once you know that maybe your blood pressure one reading was on higher side, it is about periodically monitoring it. It's not in the first reading that we start the patient on medications. We do have repeated readings which are taken either in the office or clinic or at home with the ambulatory BP monitoring. Now, again, the problem is patient sometimes becomes very, very reluctant to come back and get it checked, labeling it as white coat hypertension. It's like, madam, doctor के पास आने से BP बढ़ता है तो मुझे BP नहीं है. So that again becomes the problem. So acceptance and need for monitoring needs to be hammered in such a way that it gets incorporated in our day-to-day routine. And third important point or a barrier is once you start a patient on medicine, the compliance to the medicines. Many times they take it for a week, they're like, we are feeling better, and they stop it on their own. Or sometimes they forget. The habit is not formed effectively. So I feel in all the three levels, we have certain bridges, certain lacunae which need to be bridged. And mobile trackers, now along with these smartwatches, we can always have one more additional chip which can track your blood pressure. So all these innovations will help in, number one, diagnosing if you are pre-hypertensive, that you get, when you get your regular BP readings, you get to know that, okay, no, these readings are coming on higher side, so I better go to my doctor and consult. Other thing is, once your doctor says that, yes, you are probably hypertensive and you need your ambulatory BP monitoring, if you have again a tracker which can give you daily BP readings, acceptance will be better. That, okay, my blood pressure is on higher side, and as my doctor is saying, I better accept it and not label it as white coat and leave it at that. And thirdly, when you talk about compliance, if there is a tracker or a chip in your mobile or in your laptop which gives you an alarm once the pill is popped in, because there are reminders, there are alarms, but at times in this hustle, we forget, liya hai dawai ki nahi liya hai. That also becomes a thing. And sometimes you just look at the dawai ka patta and you're not sure. So if the pill is popped and if it is registered in your application in some way, then probably the compliance would also be better. So I feel these are a few gaps, and probably this is what a clinician mind of mine can think of as solutions.
Thank you so much, Dr. Sapna. You were able to highlight a few broad points that, from clinicians' aspect, need focus on. One of which includes acceptance to the fact that people do need to go and get checked on a regular intervals. And from government, having stringent guidelines on the same, or just promoting this notion more that just because you're not feeling it does not mean that you are not getting checked regularly is important. Also, the need for monitoring, as you emphasize, and compliance to the medicines. Now, this was from your from clinician's point of view. What requirements do you feel in your setting would help? We have people from technology space and diagnostic space as well. My next question is to Ms. Roonam. Ma'am, what do you feel? How do these gaps are they being fulfilled from early diagnostics point of view, from technology point of view, from the space that you come from? Have there been advancements made in hypertension care and early diagnosis and management and delivery? What would be
Thank you,
your
Dr.
input?
Savri, and thank you to Dr. Sapna. I think she was very comprehensive in covering her perspective. What I would say is that innovation happens at a certain pace, right? Once there is attention, once there's funding, once there is desire to deliver change, innovation starts to happen. And I think today innovation is happening. I think Dr. Sapna mentioned some of the innovations. We have wireless sensors coming up. We have cuffless BP machines coming up. We now even have something in your phone which can track the disease for you, which can track your blood pressure. And there's countless other organizations around the world that are working on making the diagnosis of BP easier. Which of these will meet the guidelines, which will meet the regulatory criteria, which will then reach the public, be cheap, be affordable, and become mainstream? I think in the next 4 to 5 years, we'll see a lot of action play out on that front. But I think a large gap that still remains and that needs to be addressed even before innovation or being aware that hypertension is indeed a killer disease. So I remember about 20 years ago when we were, fairly young, we became aware of cardiac issues. We became aware of, what are the lifestyle factors which are linked with cardiac diseases, because we saw people dying of heart attack. So we started acknowledging the fact that this is a problem and we should be aware of it. Similarly, we have, I think, as a population, become extremely aware of diabetes. And I think, progress has been made. But hypertension is still not viewed as a serious condition. Hypertension, and I can see Dr. Sapna nodding along. So I feel she agrees with me that people still will come to a doctor's clinic and say, I only have little blood pressure. And, when I hear that, I'm like, it's not a little thing. It can cause stroke. It can cause a heart attack. So you're so bothered about the fact that you have heart attack, but you think your hypertension is not significant or that it's not linked. And I inherently believe that this lack of association that hypertension can lead to debilitating disease or death is what is one of the factors that prevents people from wanting to measure it. Or, everyone has a glucometer at home today, right? And it involves a prick. Most of the glucometers we have today still involve a prick. People are willing to do that because they realize that diabetes is a serious disorder. But I don't think hypertension still gets that acknowledgement. And this is with the urban population. The rural population, which is a large part of our country, and since we're on a public health forum, I think smartphone applications are probably not going to really help that part of the population very soon. We're probably a decade away from that penetration being completed. So while innovation is happening, I will leave you with just two thoughts. One is, second is, are we innovating for the rural as much as we are innovating for the urban? I think these are the two questions that we need to think about.
Thank you, Ms. Roonam. We would be touching upon this rural point further into the discussion as well. Let me first move on to Dr. Poonam. So, ma'am, you come from the space of Servier, which has been working into this hypertension awareness. So, as Ms. Roonam has been saying, that there is a great lack of association, that people do not accept that hypertension, if uncontrolled, can lead to very grave causes in future. So how does awareness around this and initiatives which Servier keeps getting involved into, what kind of role are these playing? How much importance should be, how much emphasis should be laid on such initiatives for generating awareness amongst people, not just of urban population, but also awareness amongst rural population, so that they are able to recognize that this is not normal, and the need, also the emphasize to go and get checked from a specialist doctor.
Well, what you touched, Dr. Ashavri, is something very important, the awareness. I heard Roonam also talking about, when we do innovation, we need to answer certain questions. What's the gap? The first point in hypertension is, does one know how to get a BP checked? That's point number one. And to whom should I go to if my blood pressure readings are high? So first of all, as she rightly said, everybody is aware about this glucometer, it's there. But that's the numbers we are talking about. Why? You mentioned very interesting statistics, but to summarize it in one go, there are in India today 220 million patients who are living with hypertension and 77 million patients living with diabetes. Okay. Now, the first step is the awareness. BP hai? Okay. Kitna hai? What's my number? What's my normal number? Do I know it? For that, I need to get it checked, right? So that's where the community peer-to-peer influence also plays an important part. At Servier, I can say what we try to do is a little bit of awareness. It's a Facebook community page that we have, which is called as Because I Say So. It's not because I say so, it's because I say so. Get your blood pressure checked. That's a very simple message. Still on Facebook, we have a lot of communities, family groups, friends talking about it. Insta is there, Twitter is there, but such kind of community discussions do not happen. So that trigger in community is important to spread the message of awareness. A, the attitude towards the condition. What does it actually mean? So Roonam rightly said, if today I'm not controlled, there is a high chance of landing up in stroke. And stroke is something which nobody wants to have it. It's really disabling. In terms of awareness, as pharma, as organizations, we do try to do a bit, but I think we also must pay kudos to our government of India, who has recently won the very good initiative for the hypertension management. And they did very simple things. How did they innovate? They innovated by empowering the rural, so-called, reaching out to tier 2 mobile devices and having an app called as Simple. It is indeed simple. And with a simple checklist, the healthcare worker actually goes and visits door to door as much as coverage they can do it, and help get patients, or rather people, get their blood pressure measures checked. So this is the kind of mass screening which the government has initiated. And we will definitely see a trigger coming in from all these regions. But yeah, it's a long way to go. It's just the initiative they have launched. It has still 5 years more to go in this aspect. So innovation necessarily doesn't mean we come out with hi-fi devices, mobile watches, but as simple as getting that awareness, the attitude towards getting the blood pressure measured is important.
Some very strong points you mentioned, Dr. Poonam, that innovation does not only mean that you come up with latest technology and devices, but innovation could also be innovation in the public health practices and the entire strategy that you go about for generating awareness. So as you were mentioning that there is a need to generate awareness amongst the masses and in their attitude towards this, to touch them on a deeper level into their hearts, so that they feel that, you know, they take it as an emergency and as a very important thing, more like just any other disease that is floating around in the world. So coming on to Ms. Neha Rastogi, ma'am, Augusta has come out with a very innovative device, and as blood pressure is closely linked to, and lifestyle disorders are closely linked to heart diseases as well. Can you please share how you behind this, and how in future do you hope that similar such devices also come, which are very portable in nature, so that not only accessibility to easy blood pressure monitoring is achieved, but also cost, convenience, and other factors that might be barriers right now in this stage?
Yeah, so thank you, Dr. Asabri, for this question. I think the very pain point with which we started innovating a device like Sanket Life and more devices that Agatsa develops was this, that, you know, there were devices of to measure blood pressure and glucometers and everything. But even the people who are having these devices in their homes, are they really using it? Are they really able to and you know, these even if they know, even if they're aware of the disease, are they actually taking seriously, monitoring and seriously managing their disease? Now the thing is that in such busy lives, people cannot be measuring the vitals all the time, and the devices that we have in market, they are actually very cumbersome, very cumbersome. So although we talk about cuffless sensors and, you know, implantable devices and everything, the thing is that people are not convenient, don't find it convenient to wear those devices. Even the smart watches are not accurate. So the primary thesis of Agatsa to innovate devices was that firstly, it should be affordable enough that every household can have such devices in their home, like a thermometer. Like a thermometer is kept at home, and nobody knows that when and who will get a fever. So, but then when it is there, they have the device. So we have to understand that, you know, we that okay, hypertension is there and we need to acknowledge it as a disease, but we also need to acknowledge that, you know, we have to get into prevention of things rather than acknowledge getting the disease and then monitoring and measuring and then managing it. So prevention and early detection is the key to it. And for that, we have innovated such pocket devices which can actually be carried anywhere, and just by touch. Even blood pressure is monitored just by touch. No need to wear the cuff and everything. And just by touch, the numbers are taken, the vitals are taken, which are transferred to a mobile app. So obviously that the numbers are the trends can be monitored, and the trends can be shared with the doctor, just as is, so that the doctor knows that okay, what is the status. Even if the medicine is working or not, medicine needs to be changed or something, modified or something. So we are working at two levels. One is making affordable, easy to use portable devices, and secondly, to use that data to actually know that where how the disease is advancing and how it is actually being controlled or managed.
Thank you, Ms. Neha. You were able to highlight some very important points while looking at technology for limiting gaps around hypertension care that are required for future technologies, which is for it to be very affordable, for it to be very portable, so that people do not face any last bit of hindrance before actually using it. And also, when it comes to the data, we would be, as we are in the phase of artificial intelligence, machine learning is being used to train with the coming up of software such as ChatGPT. All the data pool is enhancing, and all the different technologies are also getting integrated with it. So we would come on to this aspect again. But my next question is to Dr. Sapna, that ma'am, we were discussing about the gaps in hypertension care, and of course the scenario in urban population is vastly different from the gaps in hypertension care management that are visible in the rural population. So as Ms. Roonam was also highlighting, that the gaps that are there in urban populations may not be entirely may not be the ones that are there in rural population, and their needs might be differing a lot. And the kind of technologies or the kind of innovative systems that we need to keep in place so that they are regular with their blood pressure monitoring and are at par with their health need to be differ. The strategies need to differ. So what do you see, in your opinion, what kind of solutions would help a rural population more as compared to urban, in your experience?
So as the eminent panelists have highlighted, that awareness and acceptance and other acknowledgement of hypertension as disease is much less as compared to diabetes. But I think we need to understand that why diabetes awareness increased. It was because of continuous hammering. There was mass campaigning which was happening. Even when you talk about rural population, if we, in their native language, if we have some broadcasts which are periodic broadcasts which are happening, which say that high blood pressure एक बीमारी है and इसके complications हो सकते हैं which can be life threatening as as bad as diabetes or other heart disease complications. So if continuous hammering, for example, if you have some periodic weekly broadcasts which are pertaining only to hypertension and its importance, जैसे मैम ने कहा कि what is normal blood pressure, what is abnormal blood pressure. Many of times patients come to me saying मुझे low BP की शिकायत है. They are okay with high blood pressure values, but they are worried about low blood pressure. So this difference, that there is something called as normal blood pressure, what is low blood pressure, what is high blood pressure. This has to be made clear, especially when we come to rural population. The awareness into these basic things is very, very important. And I think certain mass campaigns would definitely help. And I agree that they're not that digitally advanced or digitally developed, but still people do have mobiles even when it comes to rural population. So one message in a week or so, which highlights that blood pressure, high blood pressure एक important बीमारी है, and अगर आप ख्याल नहीं रखेंगे तो दिक्कतें बढ़ सकती है. As simple as that. Continuously अगर वो, if that goes under your eye, maybe the awareness would increase, and somewhere the mind will think कि okay नहीं, मुझे कुछ symptoms हो रहे हैं, या अगर मेरे घर में किसी को blood pressure है, if I have a strong family history of diabetes, heart disease, strong family history of hypertension, then again my mind will start thinking that okay, maybe I should go and meet my doctor and get my blood pressure checked once at least. As far as urban population is concerned, the awareness, I would say, is fairly okay, what I see in my patients, OPD patients, but the acceptance is lacking. Unfortunately, people think that okay, one reading doesn't make a difference, 2-3 readings bhi बढ़ गए, तो as I mentioned earlier, they label it as white coat hypertension. So somewhere these periodic monitorings with these trackers, or just as we have continuous glucose monitoring, CGM is a very, very common thing now in diabetes management. If we have a continuous hypertension monitoring device, which we just have to wear on the sleeve, and the complete data is given, and you consult your doctor, then probably the acceptance would be better. Because this is the major difference that I have found in my patients who come from rural and who come from urban. One is their awareness about hypertension as a disease entity from rural population, and in urban population, largely it is the acceptance. So I think these two things.
Thank you, ma'am. On the same note, we also wanted to know among that acceptance amongst patients that you discussed, and the varying levels of acceptance amongst rural population and urban population. But I also wanted to know from you, how is the acceptance towards these emerging technologies amongst clinicians per se? With post-COVID, we have seen that many new technologies are coming up every day, which are helping in this diagnosis or this detection and this and that. And although doctors are being updated and keeping themselves updated on these, but many of the practitioners are hesitant towards, would this work out for my patients? Would this be actually easy for me? So what kind of systems do you see are really being employed or being helpful for doctors? And what are some of the examples that you must have seen that are not really working that well and we need to work more? This could be a general health diseases focused answer, or could be hypertension specific. It's up to you.
Right. So I would say very honestly, it is taking little time in us as clinicians to imbibe these technologies, because by and large, the first and foremost thing that we have been taught in our med school is you touch the patient, see the patient, feel the patient, take the parameters on your own, and that is what is our practice, as doctors, as clinicians. Nevertheless, technologies, certain technologies like now digital monitoring or cuffless sensors have come up. So many a times when we are not able to meet a patient, or patient is not able to come for consult, especially that happened in COVID era when we had a lot of online consults going on. At that time, we realized that these technologies have come to our rescue and have given us fair idea as to what is happening with, for example, I take the example of hypertension, what is happening with the BP of the patient, whether the medications are working or not, because they had a digital tracker or a digital machine at their hand. Although we would tell them that there would be a 10-15% difference in the readings, but still we had a fair idea as to what is going on with them. So definitely technology has helped in many ways, but yes, it is taking a little while for us to imbibe that in our system as a whole.
Thank you, ma'am. So on the same note, my next question is to Ms. Roonam. Ma'am, when we talk about rural people, there is a lot of constraints around resources and delivery and, all other factors that hamper proper care delivery. So Health Cube's one aspect is also focusing delivering healthcare solutions and rapid diagnostic solutions in resource constrained settings. So how do you see such innovations that are working in resource constrained settings are really helping in hypertension care amongst rural people. I know this is not as easy to, just solve in one simple answer, but I would really like to know your thoughts.
Sure. But before I do that, I would just like to go back to the previous question, which you asked Dr. Sapna. And I'm sitting on the other side of the table. We have a couple of clinicians here, but we are business owners who actually try and persuade the clinicians to accept our technology. And I just want to add one point that every technology has its limitations, regardless of whether it's new or old. But when a technology is mainstream, when it's been around for decades, it's easy for any individual to kind of forget its limitations or to just accept its limitations and work within those constraints. So every time new technology comes in, the constraints or the limitations of the technology become the reason not to buy or not to invest in or not to try that technology. But I think responsible clinicians like Dr. Sapna and Dr. Poonam, I'm sure, accept the fact, right? Because she said there accept that every technology is going to have limitations. Your 5G network will also fail, right? I mean, I live in a huge gated community, but yahan bhi light jati hai. It's going to happen. If we can accept that every technology has its limitation, it just opens our eyes wider to, what's available, what's new, and what's more helpful. Going back to your question about the rural population, I don't think it's an easy question to answer, but it's also a much more difficult task to accomplish. The fact is, in our country, resource constraint is only one part of it. Even if you're an extremely rich person, wealthy person or a well-off person living in Uttarakhand, you have other constraints. You have geographical constraints. You have constraints imposed by events. I mean, when there's, for example, Char Dham Yatra, or there is the monsoon in which landslides happen, roads shut down. So constraints are not just about resource. Resource is one part of it, and resource is the easiest problem to solve. I think, throwing money at the problem is really the easiest thing to do. That's what public health systems are for. That's what the government is for. But what are you going to do about geographical, constraints? It's as much, public health is as much an operational problem, as much a logistic problem as it is a resource problem. Saying that it's only a resource problem, and there's this constant murmur about how much of the country's budget should be allocated to health. And of course, that number needs to change, and it's going up in the right direction. But that won't solve your problem if operationally you're not able to figure out how to get medical care, whether it's about hypertension or any other condition, to the areas that are geographically and otherwise, climatically cut off from the rest of the country. So this needs operational minds with the adequate resources to solve this problem. Of course, innovation has a large part to play, but one must innovate differently for urban population and very, very, very differently for the rural population. One small example, and I've been following Augusta, and I'm very impressed by the innovation that you guys have, Neha. But just a small example, you said while you were talking that it fits in a pocket. And because I'm working in the rural space right now, my mind straight away goes to the fact that most of the rural population doesn't have a pocket, right? So while your device will work for part of the country, you need to think about, okay, so if I were in a rural setting and this woman is wearing this sari and she has to work on the farm, it's not even the sari that we wear when we go for parties. It's the sari that's wrapped around your legs, right? Or various different kinds of costumes. Where does this device fit into her lifestyle? Right? So innovators have to think differently. You cannot solve for the urban population and then try to copy paste that solution for Nagaland and Mizoram and Uttarakhand. It's not going to work.
So I think it should be more. I'm sorry if I can just
please continue. Yes.
I think it should be designed or made in a way which suits certain regions depending on its constraints. Be it climatic constraints, be it population-wise constraints, but something like that maybe, right? It's a valid point.
Mm-hmm. And it's not an easy thing to solve. I mean, it's not easy. And people like me and Neha who are sitting on the business side, it's one person is not going to solve this problem. It's going to take tens of thousands of us to eventually solve this.
Right.
On the same note, I would like to have views from Ms. Neha and Dr. Poonam as well, starting from Ms. Neha. Ma'am, if you can add on.
So yeah, so I completely agree with Roonam's point that the technology which is innovated for urban, or let's say well-read, educated population cannot fit well for the rural population, and that's very correct, because any innovation is not done for considering the whole sphere of problems, or whole sphere of population. Whenever an innovation is done, and let's say I'll only talk about the medical devices and consumer oriented medical devices. They start with the niche population, of course, because let's take the example of mobile phone or smartphone. They start from the niche population who are savvy, like to want to try out new innovations and technology. But that doesn't mean that it cannot be put to use for the other kind of population, or the other type of population. The thing is that it might not be used in exactly the same way that urban population is using that. So Agatsa's devices might be used by an urban corporate person who's working in an office and wearing a pocketed attire, and carrying a bag and everything. But for rural population, I think even if an individual is not using, it can be used for public health, by ASHA workers who can take those devices, because it's not just the portability factor. The factor is also that they're so easy to use. You don't have to put the cuff or those leads for ECG. You just have to touch it. So the ease of use factor also plays a very important role, and also the accuracy part, the medical accuracy, which is actually acknowledged and accepted by doctors, because as we understood by one esteemed doctor, that uh, adaptability and acceptance, first is like the technology is there for a long time and it is accepted, it is known for a very long time, and also for them to accept, it has to have certain kind of accuracy, certain kind of 10%, 15% idhar udhar chalta hai, but then it has to actually do the business. So once it is doing that, I think technology can solve a lot of issues, and especially with the advent of smartphones and internet and penetration of internet and smartphones, and we know that, and with geo mobiles and everything, it is going to penetrate. So it might not be fitting right now, but yes, going forward, it is definitely going, these technology, this high end niche technology is going to help the rural population as well. So yeah, it will take time, but yes, and in other ways, it might not be in everybody's pocket in a gaon or anything, but it can definitely be in a community center, or with the panchayat, or with the asha worker or whatever, and then it might help in quick measurement and monitoring.
Thank you, Ms. Neha. Definitely, such technologies and innovative solutions open up a wide gate for future innovations and for people to inspire to, do better and produce better, so that more and more people's lives can be impacted. On the same note, Dr. Poonam, would you want to add anything on to the discussion that is already going on?
Yeah, it's quite interesting to look at perspectives, urban, rural. But what is also very important is not patient engagement, rather this is called as patient activation. Like we talk about customer centricity, we talk about patient centricity, but it's also what is the person willing to, the willingness to be part of this care or decision making process is also important. So, why not build something which can benefit both rural and urban? Now, just to give a very practical example, in COVID scenario, we did have some of our tertiary care centers where we were posted for duties. Now, I had one of my so-called colleagues, like a nurse. So she was like an Anganwadi worker. Now, what she did was she had the sanitizer small bottle with her. And I used to feel very amazed because it's the pocket issue. So it struck me over there that she used to come in that draped out sari. And I was amazed when she used to take it out, her sanitizer, you know, where she used to place it. Very interesting. She had a turban which she used to tie, and it was here. So they just, you know, it's there. Madam, hai mere paas. You know, it's like I used to offer her, but it's there. This is innovation. This is simplicity. This is what the person actually did is for convenience. So people are looking out there for convenience, and they would want to be part in this decision-making process. So maybe, Neha, Aruna, when, you know, when we're looking at urban and rural, let's take people together and see how they would, you know, respond to the devices that we want them to benefit from. So that's just the point that I wanted to mention here.
That was very crucial that you highlighted. Just similarly, if we are doing something for clinicians, we would want to have their inputs, that would this device actually help you in delivering better care? And if we are making something from the patients directly to be used by customers on their own, we would definitely want to involve the decision-making process from some of the representatives from a public point of view as well, that would this actually be benefiting you? So that is really good that you highlighted. Let us move on to the further aspect, which is we wanted to know that Dr. Poonam, in your experience, what are the key factors that you know that even after doing all these activities, what are the main pain points that you see that are there, and you know, that we would want to focus our energies first? That would be the tipping point, because as we saw, the scenario pre-COVID and post-COVID is very different. Pre-COVID, the kind of hesitancy that people and doctors had towards technology, post-COVID, it is not so much. So now we are facing different sorts of views and, you know, responses from people, and also the medical fraternity. So in hypertension care, so as to you know, bring about this necessary you know, alertness amongst people, what should be the top 3 things? And this would be a common question to all of you. What should be the top 3 things that we should be focusing on first and foremost, and then maybe focusing on the other aspects later on? Because if these 3 things were, you know, taken care of, that would do half of the, you know, issue, that would solve half of the issue. So yeah.
Maybe I can start because here when we talk about what are the 3 key points, first, get your blood pressure checked. So now one has to get that awareness of walking up to the doctor or to the nearest clinician and getting the blood pressure checked. Now, how do we empower people would be the next step. Does everybody know what's the right way to get a blood pressure check? Are the nurses equipped? Are the caregivers out there? Do family members know the right protocol, I would say, in getting the blood pressure check? Because Dr. Sapna would agree, the white coat hypertension, masked hypertension are the problems which happen in doctor ke paas gaya to BP kabhi chala jata hai, kabhi aa jata hai, you know. That's the kind of thing which gets in. So who is checking the blood pressure also becomes very important. If this so-called Dr. X is checking, it's always high. If this nurse is checking, it's always low. So that's another important point. How is the blood pressure getting checked? Who is really equipped? Is the training substantial enough at all levels? Does everybody follow the same scenario? Do we follow the rule of 3? Now, in this scenario, something that I came across, the Indian School of Hypertension does a very innovative program every year. What they try and do is they take about 50 or 60 doctors, maybe once in 6 months or once a year, depending on the bandwidth they have, and they educate doctors over there what is the right way of taking a blood pressure so that they can go back and empower their field people around. That's how you should get your blood pressure checked when I am busy seeing the patients, you know, that's the message. So it's very important how this gets measured. And the last, and that's also the third key, most important part. My blood pressure today is normal. I will not take my medication. Monday, it was little high. So in the evening, I took my medication. Tuesday was okay, so I skipped it. Skipping doses, not adhering to treatment is something which is a big problem, which is why today the hypertensive control rates are low compared to what gets seen in diabetes population. So these are my 3 parts that I wanted to.
Thank you so much. The third point that you mentioned that, some days patients are taking the medication, some days they are skipping it just because they are not feeling the symptoms in their body. And opposed to how symptoms feel in diabetes, if you do not take your insulin, you will instantly feel in a half an hour or 1 hour that yes, something's going wrong. And maybe because I, skipped my medication. So maybe this could be one of the reasons that hypertension skipping medications do not do as much harm to your body as skipping diabetes medications would have. So hence people have this tendency of feeling that I'm feeling well as of now, so I might not take it. So but the three things that you shared, that getting the BP checked first and foremost, making some sort of protocols around the age, the duration, that when and how, even if you're not feeling any sort of hypertensive symptoms in your body, but regularly getting your BP checked professionally is important. How it is getting checked is also important, that you highlighted, and also adhering to the medications needs to be prioritized. Dr. Sapna, what would be your 3 focus areas that really require emergent attention from everybody?
Yeah, so I agree with Dr. Poonam what she highlighted. I would just like to add few things. One, another important point is who should get the blood pressure check. As we know, silent killer, silent disease, as we call hypertension as. But it is important that who and at what point of time should get the blood pressure check. Correct way of checking the blood pressure? Yes, completely agree. So if you, I'm again emphasizing, if you have a family history of diabetes, if you have a family history of hypertension, heart disease, if you are obese, if your BMI is higher than normal, you come in overweight category. If you have a stressed lifestyle, we all have, but then yes, if you frequently encounter this anxiety, stress, and not able to cope up with your emotions, I think once a month you should get your blood pressure checked in a right way, in with the help of proper clinical assistance. And also, if you have a digital blood pressure machine at your home, there is no harm in keeping a track of your blood pressure. At least you will have an idea what is happening. Again, important is how this digital machines work, whether you are using them properly, whether the technique of taking blood pressure again in that simplified machine is correct or not. It needs to be verified. And maybe we can always follow an algorithm. If I may suggest that if you are above age of 30, get it checked regularly with the help of your clinician. If you are less than 30 but you have all these risk factors as I mentioned, again get it checked periodically. And as far as compliance with the medications is concerned, as rightly pointed out, skipping the doses, the message has to be loud and clear from your clinician, and that without consulting him or her, medications should not be stopped, whether you are feeling the symptoms, not feeling the symptoms whatsoever. So again, that is why I said if there is a tracker which says that, okay, you have popped a pill today or not, that will be helpful, in keeping the track of medications. So I think that.
Thank you, Dr. Sapna. And when it comes to technologies, I feel the use of those technologies are much more. The uptake of such technologies are more if they are easy to use, simple, portable, convenient, and affordable. So obviously, these are the principles that all the people work on. But yes, it is not a magic pill. Again, it is just technology. So it will have its pros and cons again. And with the coming age, definitely with the advancing developments, I am sure there is a long way to go, and there would be many more such innovations that would help in hypertension care. Coming on to Ms. Roonam Mehta, ma'am, what would be your top 3 focuses that everybody needs to prioritize first and foremost in hypertension care and delivery?
I think the doctors who spoke before me have covered everything, but I'll still try to summarize. I think awareness, hands down, is the number one and the most important thing to do. The more aware the population, more will be the willingness to change and to take action, affirmative action. Second, I think is accessibility. Is, even if you have the desire to get your blood pressure checked, but it is not conveniently available to you, whether in your house, in your pocket, or at a community center, right? The definition of convenient is different, I guess, for different people. But whatever be your definition of accessibility, access is the second most important thing. And the third thing that I think is important for both clinicians and patients to keep in mind is that normal is a range. Normal is not an absolute. So both the doctors said this in different ways. Longitudinal data is really what you want to look at. If you're going to a doctor, nothing like it. But if you're doing it at home, or even if you're going to a doctor who's not very tech savvy, you need to keep track of how your BP plays out over time. This goes for sugar as well. Because, for instance, 120/80 is supposed to be normal blood pressure. But for a fact, I know that my normal blood pressure is 110/70. That's not low for me. That's my normal. 100/60 is low BP for me. And this information was important when I was in a difficult labor situation. So each person over time will learn what is their normal and what makes them feel uncomfortable or what becomes critical for them. So tracking your own longitudinal data, understanding that normal is a range and not an absolute, is also should be part of the awareness camp.
Thank you so much. So the points that came up were the dedication to get checked, working towards making people aware from inside so that they have this feeling to, be healthy themselves, get checked, follow a better lifestyle. So initiatives around that are required. Accessibility is definitely one thing, and accessibility, as rightly pointed out by Ms. Roonam, is convenience is different for different people. So what might be convenient for the urban population might not be convenient for the rural, and also different kinds of economic populations. And also that normal is a range. So knowing that what your normal range is and how you function best is also equally important. And advocating this is also important. So coming on to Ms. Neha, ma'am, what would be your 3 things that are really important to emphasize and highlight or bring about in hypertension care and management?
Yeah, so I would start with what Ms. Roonam said, knowing what is once normal. And that can only happen when a person is monitoring it regularly, even if he knows that he's not a hypertensive patient. So there must be, this awareness when we're running awareness campaigns, telling people, making them aware that hypertension is a problem is one thing, but also making them aware that when do they need to start monitoring it and start monitoring it regularly. That is something that is very much required. Now that can only happen when both the doctors or clinicians and the patients or the users work collaboratively. What we see in India is, a patient goes to a doctor only when he feels some symptoms, only when he feels that he's not well, and then the doctor measures, do all the measurement and everything, and he or she prescribes the medicine or whatever advice is given, and he goes back, he follows the advice, and then he forgets. Now, today in the digital times, I think this needs to be changed. The patient and doctor must work more collaboratively. The data needs to be monitored and it needs to be there. So there must be a backup. Now, where most of the digital machines, we just see the numbers and we forget. Okay, kal mera ye tha, aaj mera ye hai, but we don't hardly take a note of it. So there must be, technology must solve these problems, that a trend is being made and that is being shared with the doctor, and doctor seeing it and saying, oh, this is your normal, I don't think this is a problem because this is what is happening. So that is one. The patient and doctors working collaboratively, adopting these digital technologies and making technology to their use to actually solve the problem. The second thing, in terms of hypertension, I would like to point out that we must also need to know our triggers. So, as Dr. Swapna rightly mentioned, that, we all are living in stressful environments, anxiety, stress, and, a lot of other factors, even pollution. So we need to know our triggers, and we need to make people aware that, even a 20-year-old can be hypertensive if he is living in certain kind of conditions. So again, this should go hand in hand with the collaboration of doctors, that, if there are certain conditions, you start monitoring, and you start seeing the trend, and you start acting upon it. So one is knowing, second is monitoring and measuring, and last is obviously to act upon it. And knowing that, this can, because hypertension is not a disease in itself per se, but it is also a risk factor to many more diseases like cardiac diseases. So it has to be made aware that, even a normal person, or like we say normal, like a 20-year-old or 25-year-old, can have this disease. And finally, of course, these factors need to put play, that, these data, and these measurements and everything need to work in an artificial intelligent way also, to advise people that, to actually notify them that now is the time to monitor, now is the time to take your medicine, now is the time to see your doctor. And even if you don't want to see your doctor, go and chat with your doctor. So I think I talk only in terms of technology, because obviously, I am solving a problem which, India specifically as a country has, that we in India healthcare is very, very fragmented. We only go to the doctor when we have a problem. We don't work on the other side of it, which is preventive care. So actually prevention needs to be, is actually to be started, to actually know when the problem is, is on the onset, and then take an action upon it.
Definitely, Ms. Neha. Thank you so much for pointing all those different aspects. Definitely agree with you that prevention needs to be prioritized in Indian setting and in Indian mindset. What usually people do is they only see a doctor when it's too late. When it is too late and they have already faced the consequences of a high blood pressure, of a bad cardiac health, or something has happened in their nearby family member, or close kin, or to themselves sometimes, only then they get checked. But awareness around this aspect, that regular monitoring and keeping a check of your blood pressure, whether it may be from a specialist or by yourself, is equally important. We started out really strong. We had amazing panel here with us, beautiful, talented, amazing women. And I was honored to be hosting this session today. On the same note, let us come on to the very last aspect, which is parting remarks from all of our panelists. To all our viewers that are watching, what would be your advice or your suggestions, remarks? Let us start from Dr. Sapna.
Right. So I guess the points are very, very clear. Awareness of hypertension as an entity, as a problem-causing disease, and the other thing is acceptance. Be aware that there is something called as hypertension, and if it is there, we need to acknowledge and accept the fact and act upon it, as rightly mentioned by all others. That acting on it and maintaining the therapy, without skipping the doses, and of course the other preventive aspects, because you have hypertension, don't get boggled by the fact that, okay, I have a blood pressure ka bimari bhi aa gaya. Because as we have slowly accepted diabetes as a community disease and started acting on it, it's about time that we also accept hypertension as one of the disease entities which can be cured, which can be prevented from causing complications also. So I think that should do it.
Thank you, Dr. Sapna. Ms. Roonam, what would be your remarks?
I think just keeping it very simple, two things just, right? For the public who are non-clinical in nature, we've said this over and over again, I think all of us in different ways, that you must get yourself checked at a certain frequency. It could be monthly, it could be yearly, and that, let your doctor decide that. But just do those checkups and keep track of where your health is going. Because finally, when your health deteriorates, you suffer more than anyone else. And for clinicians, I would just make one remark that, like I said earlier, all technology has its limitations, and every technology was new. No technology was accepted on day one. I'm sure when vaccination was first created, there were enough people who thought, it's insane. You're almost like injecting poison in your veins, and some people still think that. But the fact is, vaccines save life. So even life-saving innovations have had naysayers. The more clinicians we have who are at least willing to try technology, I think the better off our population will be. They have to be the ones who drive the change. It can't be us.
Thank you so much. Dr. Poonam Gupta, ma'am, your remarks.
I will come back to this awareness part. So this is May Measurement Month. What everybody can do out there is get involved. That's also the theme of May Measure Month. What one has to do is just go and log in to maymeasure.org. Enter the blood pressure readings. There's no patient details that is being captured. These are just numbers, because they say at least that awareness is important, that 1 minute arm squeeze will let you know what your blood pressure readings are. So because I say so, go and get your blood pressure checked.
Thank you so much. Ms. Neha Rastogi, your comments, ma'am.
So I would like to say the same things as other panelists. Monitoring and regular measurement is very much required. Awareness at both the levels, like that hypertension is a problem, and that you can also have hypertension. So start preventing it, start monitoring it, and start acting upon it. So I think that is very much important. And second part is the doctors and the patients or the users working in a collaborative manner, so that the doctor knows that, okay, this person might have this problem, and the doctor might start advising in that way, and the patient knows that I am at a risk, so I should start talking to my doctor. So that collaboration needs to be made in this time. Yeah.
Thank you so much. With that, we come to the very end of this amazing discussion today. We'd like to thank Dr. Poonam Gupta, Ms. Roonam Mehta, Dr. Swapna Khanzode, Ms. Neha Rastogi for taking out time from your busy schedule and imparting us with wealth of knowledge and information today. Thank you so much. We would also like to thank our partner, Servier, for this brilliant initiative for raising awareness around hypertension for the May Measure Month. Thank you so much. We would also like to thank our viewers for staying with us till the very end. And I hope this session was equally insightful and interesting for you as it was for us. Thank you so much. With that, we bid goodbye. Thank you. Have a nice day. Stay happy, stay healthy.
And thank you, Asavri.